COVID-19 pandemic has been disrupting the lives of billions around the world. Yet, how refugees and immigrants are coping with the situation has been rarely reported. Weave Tales has partnered with the Florida Immigrant Coalition and We Are America to find out how these communities are dealing with the epidemic through the voice of their leaders and discuss what needs to be done from now to better protect their lives. Our first guest is Ranna Abdul-Jawad, a humanitarian and the executive director of the Arab American Community Center of Jacksonville, Florida. Basma Alawi, a refugee from Iraq and the refugee organizer with the Florida Immigrant Coalition and the executive director of Weave Tales, had a conversation with Ranna on April 5th and asked her about the situations of her community in Jacksonville and in Palestine, where she is originally from.
Sure. My name is Ranna Abdul-Jawad. I am Palestinian American, live here in Jacksonville, Florida. I'm the executive director of the Arab American Community Center in Jacksonville. We have a couple of chapters. The biggest one is in Orlando. We have created one here in Jacksonville to serve our Arab community. I serve on a couple of boards. One of them is the Islamic School. I also serve on the Floridians Responding to refugees. We help and assist resettling refugees in Florida. I also participate in interfaith events, FSCJ, UNF. I'm a TEDx speaker. I have a TEDx speaking about raising a Muslim daughter here in America. So I try to, my role as much as possible to really involve the roots, my faith, my culture, and where I'm from. I'm also a wife right now and a mother. Very important to mention that during quarantine that I have 2 kids at home that we're trying to keep busy during this lockdown. It's definitely at first was hard, but we started to get creative. A lot of great ideas from everybody. Everyone went on social media, start to chip in with ideas, and we start to utilize and see what really works for us, either with our kids at home or with the community outside. Because I'm used to be really out and about in the community and be present, either, attend the meetings at the mosque or go to someone's house, a refugee family that needs help and needs somebody to sit there and talk to them and translate documents and things like that. So we're used to be really out on the fields, and now we have to change the approach differently. But also it's definitely been hard to do all that in homeschool. A huge mad respect for teachers everywhere. It's been very challenging, but at the same time, it really allows you to appreciate the people that are part of your life every day, and now you're just doing it all on your own. Absolutely. It's definitely emotional because you know that there's certain needs. There's a lot of help that they need, that your hands are tied and you really can't do so much. I mean, some of the refugee families that have a hard time is really even just homeschooling because of the language barrier. There's a lot of language barrier, and we try to help as much as possible on the phone. A lot of teachers have been great, and also reaching out to students. So that's definitely been difficult to know, and to know that they're doing a lot of that on their own. When they rely on us for help, even with transportation, it's sometimes it's really just heart-wrenching to know that they need to get somewhere, and they used to go on public transportation, and they're afraid to do that now. And you do want to help as much as possible, but then the limitation of being keeping distance and social distance is that you can't go and pick them up and take them where they want. Certain things that we're trying to do is see if there's something that we can replace that. If they need to pick up things from the grocery where they used to take a transportation for. We try to go and get the list for them and leave it outside the door, and try to limit as much as possible any contacts. Going to the post, just basically bringing up the gratitude and reminding everybody that at the end of the day, the compromises that we're making, the directions that we're following from the healthcare officials from CDC, like, I know not a lot of people have lived that, and I know it's so new to a lot of Americans, but refugees or people that come in from a country of war, or I mean, it's not that we're used to it and we're okay and we're handling it okay right now. It's obviously different, but at the same time, we have lived a lot of the steps that we're doing right now and the preparations that we're doing right now. We lived under curfews. I was back home in Palestine during the Gulf War, where the countries around us were basically fighting with chemicals, and we had to really figure out to get masks, and I know Palestinians were unfortunately not able to get masks. The masks were only distributed to the Israel side, and Palestinians had to just get creative, just like we are getting creative now, because we are short on masks and people are getting creative, sewing their own mask, donating masks, and it really reminded me of the time that I lived in Palestine, and we were also short on masks and we didn't know how we can protect ourselves. So it's definitely brings a lot of memories, but at the same time, the gratitude that I wanted to remind people is that living in this country is a little bit different. We have a lot of advantage. We have access to communications that we did not have when I lived in Palestine. We had, a lot of easy way to get what we need, which we didn't have that as well. So I just wanted to remind people from somebody who lived very similar situation years ago, under even harsher circumstances, that we're still blessed in so many ways. We just need to see it. Of course, regarding the question of how people handling it back home, it really depends in Palestine. Where do you live? Obviously the Palestinian territory, they're trying to do as much as possible to help their people. They're not prepared for that. And to begin with, even before this epidemic, they were not prepared for any major crisis because of their economic needs, because of their the limitations that it's basically forced on them by Israel. And one of the things that when I talk to them about it is that they still need to go out and work. And when I talk about work, it's a little bit different than here. There's a lot of corporations and there's a lot of businesses here that can actually allow you to work from home. It is really hard back home. A lot of people, builders, constructions, business owners really have to go out and they have no option. There hasn't been a complete shutdown, so they're still doing what they have to do to survive. But also a lot of concern is now going toward Gaza. Gaza is definitely not prepared. And that's because of the multiple wars that they have to go through, as well as 13 years of siege. So 13 years of siege where they couldn't get in the past even prepared for even cancer patients. So cancer patients in Gaza, it has been and still need to actually travel outside of Gaza if they are allowed to get the healthcare service that they need. So imagine now there's even more limitations. They don't have enough supplies, and also they're very, very crowded. They're living right next to each other, on top of each other. It's a refugee camp. So it really takes just few people to get it to unfortunately see a huge crisis that erupts over there in Gaza. Absolutely, communication. And you actually touched on the lack of, or the barrier, or the language barrier. And we definitely need to continue the communication and encourage our community to really follow the directions and to really take this seriously. One of the things that I unfortunately have noticed, that we have a group that taken it very seriously, but unfortunately we still have a lot that's not taking it seriously, and the numbers speaks volume. I mean, we're looking at the numbers of Duval County, as south side, and Jacksonville Beach, which is the two areas that usually have a lot of, you know, nightlife, and the beach is, you know, with the weather right now, is beautiful. And I know everybody's tempted, because it's the best weather in Florida is usually March and April, and everyone's tempted to be out. We just really need to encourage people to just follow direction. It has to be all or nothing. We can't have half of the community doing it and the other half is not doing it. So if there is a miscommunication, for example, with the Arab community, because they're really not understanding what's on the news, which I really think we should have, we should be able to communicate that in different languages. We have Americans that live here who are immigrants, and some are not still. You're still learning the language. We have refugees that just came here 6 months ago, and not just Arabs. I'm talking about refugees from, you know, Africa, from Latin America, from all these countries that still really needs the help. And I've seen that on social media. A lot of people are been translating documents from CDC, from the mayor, and then actually putting it on their page with the different languages and translating it, which is a great idea, but I think we should and still do more of that.
I agree. And I know there are many organizations who stepped in to make sure that we do have English language access to our communities. Florida Immigrant Coalition have a hotline, and New Florida Majority have a hotline. And we are trying to make sure that these organizations are all connected so they could share the resources with our communities.
Definitely, the community support is now needed more than ever. The leadership is actually now needed more than ever. So we need to make sure that leaders lead by example. Faith leaders especially lead by example. I know we're so tempted, especially during this time, to gather together, pray together, go to Friday prayers together. I am so glad that our mosque took the stand to close it and not allow that and going virtually. That's beautiful. But I have heard other mosques in the US that have not done that yet. And I think as faith leaders, a lot of people really look up to them. So if they feel or see that they're out and about and not taking it seriously, well, guess what? The people that pray behind them is going to follow the same thing, because their mentality is going to be the same. So we need to really, this time, we need to lead by example. Community support is so much needed right now. It can be a small thing. It can be the simplest thing that you will do. Just calling your elder neighbor, you know, checking on them to make sure they're okay, they don't need anything. You know, there's a lot of things that we really can do together. Sew mask, if you're good at sewing. I'm not, so I had to learn it from YouTube and videos, and that's, you know, that's how I really started. But if you have all the materials, if you have a sewing machine, a lot of these health providers really need it. I mean, there's so many small things that you really now can do that can bring the community together. I mean, we have seen how New Yorkers just really overcame when September 11 happened, how they all came together as a community. And I promise you, if they didn't do that, they would be still in such a bad situation. So we really need to learn from them and see that when we are together, anything we can accomplish anything. We can make this crisis that we're all having a hard time to deal with a little bit less easy for all of us. One more thing, I'm sorry, just to bring up. I know for a fact from the few calls that I got, because we do also help with domestic abuse cases in the AACC, that we actually are receiving a little bit more calls than usual. And it's such a sad situation because we're having, kids in abusive families. We're having women in abusive relationship that now have to even endure more of it because they are together in that house, not going anywhere. And we're getting these calls, and there's a lot of things that we as a community need to really keep an eye on. If you know that there was any red flags in the past before this happened, please make sure you call and you check on them. Make sure that that they don't need anything, and sometimes they just really just want to talk, because that's what's going to get them through this. So I just want to get that message out, please, because it has been more cases that we're getting than before.
That's true. That's so true. Thank you so much, Ranna. Thank you.
My pleasure. Thank you, Basma.